Hey everyone, I wanted a video that's centered around debunking the common talking points people use against people who are transgender and those who advocate for them. Watch the two previous videos if you want to have complete information. Some of these counter-arguments rely on things said in those previous videos. Number 1. Transgender people are suffering from a mental illness. I have a whole video on this topic, so I'd recommend you there first, but here's a summary. Now this one really gets under my skin because the people who play this card likely have no experience in mental health. In the US, the American Psychological Association, or APA, defines mental illness and determines what constitutes it. Internationally, the World Health Organization does the same. Both have come out and decided that being transgender does not constitute having a mental illness. Another sub-point that comes from this is that gender dysphoria, a term in the APA's diagnostic textbook that is technically a mental illness, equates to being transgender. However, not all people who are transgender have gender dysphoria. Lastly, people point out the suicide statistics of trans people are higher than the average population. But again, those who define mental illness have already considered that. They found that the high rate of suicide is likely due to discrimination. Again, my previous videos have a more thorough look at this question. Number 2. It's not a solution to pretend that transgender people are the sex that they think they are in their head. Anyone who thinks this is unaware of the distinction between gender and sex. If not, they're purposefully misrepresenting an argument in order to make it easier to attack, which is also known as strawmanning. Gender has to do more with masculinity and femininity, though it's sometimes interchanged with male and female. We can think of tomboys and tomgirls, and we have no problem understanding what this means. There are guys who act more effeminate, and girls who act more masculine. These adjectives are not based on what genitals you have or your chromosomes, but how you present yourself, how you behave, and how you feel. Sometimes we present ourselves differently than we actually feel. Boys are told to man up when something tragic happens, like watching their dog die. So they do, they keep their tears in. They are pretending to hold this gender role because society deems it so, yet internally they're probably scared and sad. However, if they let this emotion out, they'd be called girly. Some boys totally reject this notion of holding in emotions and other masculine gender roles. They hold an effeminate demeanor, and besides their body, are as a girl. Sometimes they identify with their feminine gender identity so much they wish others to call them by feminine pronouns and even a new feminine name. This is not pretending. Alex, on your birth certificate it says Alexander, yet you ask for everybody to call you Alex because Alexander sounds old-timey and you identify with Alex better. But I'm not going to ignore your birth certificate because it threatens your subjective sense of who you are. I'll admit this isn't the most charitable comparison to what is normally said, but the point is the feeling that you get from hearing it. It's likely similar to what pro-trans people hear when you say the actual phrase. When you say either variation, you come across as a jerk, and people are less likely to hear your message. If a transgender person has gender dysphoria, part of the solution might be to discuss with family members gender-affirming behaviors and the possibility of sex reassignment surgery or hormone treatment. This of course includes informing the client and parents, if involved, of the diversity of gender identity, types of medical interventions available, and the implications of any changes in gender role and the use of medical interventions. Number 3. Gender-affirming approaches are child abuse. There are two main arguments here. One is that the parents are ruining their children by permitting the child's expression of the opposite gender. The second is that of using medical, hormonal, or surgical treatment is harmful to the child. I feel of all the arguments here, this one is probably the most warranted. Nobody wants their kids hurt. The first one is pretty easy to debunk. The idea is that because parents are affirming the child's preferred gender, the child will get bullied or ostracized at school. This may happen, but to blame it on the child or the parent is unwarranted. We wouldn't say that a child being bullied at school for being gay was the child's fault. The problem is with society's treatment and understanding of them. Prejudice is the problem, not the parenting or the child's expression. The Williams Institute suggested that suicide was a result of bullying and discrimination. And a report prepared by TransPulse suggested that anything less than strong support may have a deleterious effect on child's well-being. Before I get to the second point, I feel I need to elucidate the fact that there are two types of transitions: social and medical. Social transition involves dressing or playing as the affirmed gender. Social transition is safe, but individuals who transition socially may face prejudice. Medical transition usually involves physical changes to match one's gender identity. Gender spectrum suggests, as a parent, when unsure when a transition should be applied, ask yourself, will my child be safe if I let them do this? And to evaluate if they currently feel safe and satisfied, or if they are suffering. Children require support from their families. If you deem medical transition is too much for their current state, age, or what have you, it can always wait till later, but love and support is necessary for all stages. This topic is a bit more difficult. I don't feel I have the authority to suggest conclusively whether or not medical and hormonal treatments are safe, especially for teens. What I can say with fair certainty is that it is safe to have this conversation with your doctor or a doctor specializing in transgender issues. I'm including a research dump someone shared on Reddit having to do with hormones and transgender issues. I want to briefly bring up two studies. One is a literature review on those receiving hormonal treatment that basically concludes that hormonal treatment is safe with medical provider supervision. However, for one, the study was done on adults. Its results can't be accurately placed on kids as well. Secondly, there was a risk for transgender individuals to develop venous thromboembolism or polycythemia and an increased fasting glucose. The second study, also done on adults, suggests that there should be careful consideration for bone and heart health while people are on cross-sex hormone therapy. The main reason I brought up this study is that it does mention some kind of special consideration for teens. It mentions, in some situations when delay of therapy may lead to psychologic and cognitive trauma in a child, it may be appropriate to commence therapy earlier, that is, hormonal therapy. It goes on to say, in such cases, it is important to have a multidisciplinary approach to treatment and management, and parental support is imperative. Lastly, it emphasizes that the care of this population should be left to the specialists who are well versed in this type of care. Gender-affirmative parenting in itself is not child abuse. Remember that gender-affirmative parenting is not forcing the child into medical treatments, but letting them freely explore gender roles and how they express themselves, without judgment and with support. In fact, providing support is more beneficial than not providing support. As far as medical treatments go, however, it's best to talk with a doctor before making a decision.
Number 4. I'm not going to ignore basic biology because it threatens your subjective sense of self. Again, this person likely doesn't understand or is purposefully misrepresenting the difference between sex and gender. Okay, just to be charitable, we'll take their argument to mean that there's no biological basis for being transgender. Against their point, there actually is a biological basis to becoming transgender. I'll admit that this isn't something you'd learn in quote-unquote basic biology, but you might learn about this in a college-level bio course. First, we have those genetically who are male or female, that is XY or XX. However, their phenotype will be different, meaning that they will have an appearance of somebody opposite of their genetic sex. Because their appearance is different, they will be raised differently than they would had their chromosomes and phenotypes matched. Then, you have all the other variations of intersex, where the physical characteristics are both male and female. There is a more thorough description of this in my gender and sex video. Secondly, I want to talk about the fact that the brain of transgender women has been found to more closely resemble that of a cisgender woman, rather than a cisgender man. They found that the bed nucleus of the strata terminalis and the sexually dysmorphic nucleus of a brain in a transgender person who is assigned male at birth resembles that of a woman who has a feminine gender identity than it does with a male with a masculine gender identity. Basically, there's an area in the brain that differs in men and women, yet those who are transgender have brains whose area is more similar to the gender they identify as, not the biological sex they were born with. I could go into the biology more, but it's still missing the point. Even if it was the case that there was no biological evidence, it doesn't follow that they should be the targets of harassment and bullying. It shouldn't be hard to say he instead of she or vice versa. Number 5. You can't identify as 60 since you're not, so you can't identify as a sex you're not. First, I'd like to say that this is a straw man. I really want to give Ben the benefit of a doubt that he wasn't misrepresenting it intentionally, but in all likelihood he was. Gender is not akin to age, and he was mixing up gender and sex. I say this because he could have said, you can't say you're 60 since you're not, so why say you have this genitalia when you don't? Even then, it's not the best analogy. Age is based on a whole lot of nested abstract ideas, whereas sex is more concrete and physical. I'd like to introduce a better, though still imperfect metaphor. You can be 60 but still feel like you are 45, which I'm going to refer to as vitality. There are 60-year-olds who are healthier and more energetic than the average 6-year-old, and also express themselves more like the average 45-year-old would. Saying their age is 45 would be incorrect, but saying they identify more with 45-year-olds would be correct. Saying their vitality is 45, as I've defined it, is correct.
Side note, I can see some people using this as justification of pedophilia. It's not. Trans age is not a scientifically confirmed thing. Just because you feel youthful doesn't negate the power you have over others, nor does it negate the lack of informed consent minors can give. To continue the analogy, some people are born with male biological features, such as male genitalia and XY chromosomes. However, they may express themselves in the way that we've typically associated with women. It may be incorrect for them to say that they have female morphology, but it would be accurate for them to say that they identify as a woman. Saying their gender is that of a woman would be correct.
Number 6. Allowing transgender people to use their preferred gender's bathrooms will lead to rape. I feel like I have to attack this one on several fronts.
For one, how will you know if someone's male or female? No, not their gender, but sexually speaking. This is actually more of a gray area than you think, and this section may get a little crass, so just be warned. So you could look at their genitals. People with penises go in men's and those with vaginas into women's bathrooms. This would mean at every restroom we would have to assign designated genital checkers. There was a public outcry when the TSA started using scanners that show people basically nude. I don't think the public would go too much for this idea. Also, you have the problem of intersex individuals. These individuals have sex characteristics for both sexes. We'd have to come up with a way to decide which bathroom they'd go in. So perhaps there's another way. You might instead want to look at overall body structure. If they have an angular jawline, facial hair, and Adam's apple, they'd go to men's room, and if they didn't, they'd go to the women's room. This would be less intrusive, true, but there are also still people who have masculine body type of female genitalia. This also allows some trans people to go into the bathroom of their choosing, but only if they're passing. This is the thing you're trying to prevent from happening, so it's probably something you don't want. I will say that this is probably the middle ground between the right and the left's views on the issue, but it doesn't make it the correct view. The notion of passing is discriminatory in itself. Lastly, you could go off of what people say they are. If they say they're men, they go to the men's. If they say they're women, they go to the women's. I'll concede that as a society this will be weird and it'll take a little bit of adjusting, because we've had a certain way of assuming how to segregate the bathrooms. But otherwise, the concern seems to be that it'll lead to rape. To quote gun rights advocates, criminals don't care about laws. A rapist will rape no matter what the bathroom laws are. Okay, so the National Task Force to End Sexual and Domestic Violence Against Women have a very specific goal. Obviously, they want to end sexual assault and rape. They sent out a statement signed by more than 20 organizations that basically said that they support people who are transgender accessing facilities that match the gender they live every day. They also state that non-discrimination laws do not allow men to go into women's restrooms. Keep in mind these are experts in sexual assault prevention. There are already more than a dozen states that allow transgender people to use whichever bathroom they want. And in those states that have these anti-discrimination laws, police and school officials say they haven't seen any increase in rape since the laws have been in effect. In a survey of over 27,000 US transgender adults, it found that nearly 60% avoided using a public restroom. 24% had their presence in a restroom questioned or challenged, 12% were verbally harassed while using the restroom, and 9% had restroom access denied. This suggests that many transgender individuals avoid the restroom to prevent being harassed, or are in some way harassed when using the restrooms. To clarify, though there is no evidence of increased rape in these places with anti-discrimination bathroom bills, there is evidence of harassment and discrimination for transgender people. Thanks for listening this long if you began in opposition to me. I hope I at least got you to have a better understanding on these issues as more gray than black and white. If you have any honest questions or comments, post them and I'll try to answer them to the best of my ability. Again, thanks for watching, do me a favor and have a good day.